I don't see any obvious blood on this side either, but there could still be high blood pressure. Usually when you get into a systolic over 200, that's where you start to see that retinal detachment. It is dangerous territory. This is a menace response, so essentially if something is coming to the face, he should blink. Seeing it is a normal response. He does blink better on the right versus the left side. He does not have a cataract, and it doesn't look like he has glaucoma. Sometimes that can cause issues with vision, but the eyes, the white of the eye can be very red, but he does not have very red eyes. So I'm just going to make a note of that. Another thing that I try is to see if they can track a cotton ball. They shouldn't hear it, but should see it. Okay, so he did turn his head a little bit. Okay, so he is moving his head. I believe he's able to track it to see, but I do think there is some compromise to his vision because his pupils are still very dilated, and he's not blinking as reactively on the left as he is the right. I'm going to take a listen to his heart. Heart is sounding good. I'm going to listen to lungs. The lungs sound good too. I'm going to check his gum color. Sometimes pets with kidney disease, they can become anemic. Their red cell count can be low at times, and sometimes the gum color can be pale. Hi, baby. You've been eating your food good, haven't you? All right. Gum color looks good. And then I'm also just making sure they're not really dry. If they're dehydrated, of course, the gums will be dry and tacky. Thank you, baby. I know, I'm picking on you. And then the next thing I'm looking at is just how well his skin snaps back after I tent it. When a pet is very dehydrated, it's like a raisin. It just continues to stick up. It's a slightly slow, but it's not bad. I wouldn't say that he's profoundly dehydrated, but we'll give fluids today. It's, you know, what we can do best for the kidney. I'm going to feel the belly. You still doing okay here, Onyx? I know I'm picking on you. I know we got x-rays earlier this year. We did chest and the abdomen x-rays. I looked at those and everything checked out good. I'm feeling his bladder right now. It's medium-sized, but he's not acting painful. He's not, you know, tensing up. He's not trying to get away. Granted, he's grumbling a little bit, but he was doing that when I was looking at his mouth too, so. I'm feeling his kidneys. They don't seem painful. I want to check his pulses really quick. It feels good. I just want to look once under your tail too, sir. Okay. It's okay. Can he get into his litter box okay, or does it seem hard? Okay. And then I want to feel along his spine just to make sure there's no pain or discomfort. Sometimes there can be arthritis or he injured his back, so that's harder for them to want to jump up on things. Cats can be very good at hiding pain too. Good job, Onyx. He didn't tense up there, but I want to do a little deeper test this time, a little harder pressing on his spine. He did flinch a little bit at one spot, so I retested again to see if he would do that same thing, but he didn't, so it's not repeatable. And on the x-rays, they did get the spine when they got his abdomen, and they didn't see any bad arthritis there. I'm going to check his feet too, something that can help me determine his sense of balance with the brain. Sometimes there can be something affecting the brain that can make them wobbly and unsteady. I'm going to lift you up a little bit here, bud. Yeah. This is called proprioception. Flipping the foot upside down, the body does not like it in that position, so they should immediately flip the foot back up, which he's doing. Good job, sir. I know I'm picking, huh? Okay, so yeah, with him righting his foot, it makes me less concerned of like a lesion in the brain, but I think what I would like to rule out, because it's easy to do and something that we could manage, is make sure he doesn't have really high blood pressure. So usually it'll take about 15-20 minutes for us to get a couple readings. We'll probably just bring it in the room because it's a quiet area. Ideally, I like for them not to be stressed, because in the clinic, if they are stressed, it can sometimes falsely elevate the blood pressure. So we'll bring our gear in and check blood pressure. Okay? All right. Do you want to just send her that video?
She said front arm probably, but would the tail be fine, Dr. Carter?
That would be okay too, yeah.
I can do that. I also gave him the vaccine. It's okay.
I didn't see how many fluids we've been doing on him.
It's usually
100.
100.
Okay. That's what I was going to recommend. And we usually like to get 3-ish different reads because we average those 3. Your tail's just getting a weird hug, bud, okay? Onyx, you don't look too thrilled.
He's a very good patient. So.
Good job, baby. And the machine at times can be finicky, so we have to appease it. So sometimes we have to try a couple times here. Good job, Onyx. They should have a blood pressure pretty similar to what the human ideal blood pressure to be. So we usually want it about 120/80. When we start to be worried about hypertension, it's usually when our systolic is at 180. The first read that we have is 177/96, so that is high, but I want to see what the next numbers are that we get here. I've had much worse, but good job, sir. 173/97. One more time, bud. (169/99). So it is borderline moderate hypertension. Typically with that, I will usually start a patient on lower end dose of blood pressure medication. I will need to write a prescription though, because we don't stock it here. The catch though is that Often when there is high blood pressure, it allows the kidneys to filter better. So we are walking a fine line. We don't want the blood pressure to get too high, but having some high blood pressure can help better flush for the kidneys. So in ideal circumstances, what I would look at is in about 2 or 3 weeks, rechecking a blood pressure to see where we're at after we've been on the medication. Depending on that number, it will dictate on whether we need to adjust that dose or stay at that dose. And then it would be good to get a small panel of the kidney values, just because when we manage the blood pressure, sometimes that can cause a little change there. We don't necessarily need to do a whole big panel like he did 3 months ago. I would look at just looking at his BUN and his creatinine. Those are 2 kidney enzymes. We could do it in-house, and each of those slides, they're like $15 or $18 a piece. So that's not too bad.
Yeah. So we're halfway done.
Thank you. Thank you, guys. I'm going to get that prescription then for the blood pressure medication, okay, guys? Thank you, ladies. They've given the fluids now.
Onyx is very used to this, though.
Yeah.
He does very well.
He's doing good. He's gaining weight.
Good.
It's almost done. It's almost done.
All right, one more big squeeze and he'll be good to go. Good job, buddy.
Makes me feel better.
All right, we're done. Let me just close this line. He's all set. Perfect. Good job, Alex. Spit out at you. There you go. Perfect. All right. I can take this, Mary. Great.
Good job. Good job, buddy. It's okay.